Happy Friday, everybody. For those who celebrate, it's Good Friday. Happy Good Friday to you. I'm Dr. Cindy Duke, your Johns Hopkins and Yale trained, board certified obstetrician, gynecologist, reproductive endocrine, infertility specialist. And I'm here to go live today in celebration of World Health Day. And I'm really excited about this of Zanmi Lasante, and you'll learn all about that organization shortly. But welcome, everybody. Welcome, welcome. Invite your friends. It's going to be a really engaging and informative conversation. Again, today, April 7th, is International World Health Day. And so we're going to talk about health in a particular sector of the Caribbean that really holds a near and dear place in my heart, but one that I think we need to do a much bigger job talking about what's happening there right now. And so without further ado, I'm going to go ahead and get our special guest in here. For those of you who haven't seen me for a while, yes, indeed, I haven't been doing a whole lot on social media. In fact, today is 6 months to the day since we lost our mom. And so I did take a step back from social media to focus on that. But this is something that's really, really near and dear to my heart. And so thank you all for joining. Do please engage, ask questions, share. Send this out in your IG messages to those who will be interested. I keep accepting the request here from Partners in Health, but they haven't joined yet. They have, yeah. Good morning. Good afternoon for you.
Thank you. Good morning.
Good morning. Good morning. Well, guys, meet Mark Julnis, the Executive Director of Zanmi Lasante. And of course, I'm going to have you correct me in how I pronounce it, of course. But I also want you to just tell this audience all about who you are, who Zanmi Lasante is. And of course, you're joining from the Partners in Health page. And I'll leave that to you to explain what the connection is, because it's literally a translation, really. And so we're going to let you do that. But good morning. Happy Friday. And where are you at the moment? Tell us all about yourself.
First of all, I'm such an honor just to be here with you and just to really share. And I'm looking forward to delve deep into talking about women's health and some of the disparities that we face. But it's Zanmi Lasante, which is Partners in Health in Haiti. We are a sister organization to Partners in Health. Actually, PIH started in Haiti, where we are the birth of it. As you said, I am the executive director and have been for the last several years, but I've been working with Zanmi Lasante since right after the earthquake, actually. Been here in Haiti since then.
And, I really like that you pointed out that Partners in Health started in Haiti. And indeed, we recently marked the 1-year anniversary of the passing of one of the founders, key founders, Dr. Farmer. And Haiti just meant so much to him on so many levels. And he started there and grew Partners in Health to what it is today, yeah, which is 12 countries and other amazing partnerships. But I'd love to delve into that initial founding and what it was that drove him and brought him to Haiti to begin with and to start Partners in Health and what that's grown into. And then hopefully I want to touch on what you're facing now, because there are some really new, dynamic and unique happenings in Haiti that are presenting new challenges to what people probably historically understood about healthcare there. Tell us some more about the founding and how it's grown.
Oh yeah, this is going to be longer than a half hour. But it's equal parts emotional, sad, and joy, because exactly what we're talking about, the health inequities. It started because Dr. Farmer went there and really experienced and saw some of the inequities and asked the question why, and was sort of blown away by some of the responses. Well, that's the way it is, or you can't do that. And he did what many of us want to do or now are really pushing to do, is making that difference and pushing and saying, well, that shouldn't be how it is.
Yeah.
It shouldn't be the accepted status quo. It shouldn't be that a woman that needs blood has to travel hours and is dying for blood. It shouldn't be the fact that somebody's seeking care because you don't have the money on you that you can't get access to quality. Let's be there, quality care. And I think it's because of that question of why. Or why not? Why can't we? And pushing that envelope that we have partners enough. And that's a very short, wrapped up, you know, candy bite version, because it's so much deeper than that. And I think a lot of times when you hear about Haiti and what you touched on, people sort of disregard it as is this troubled nation. But if you really delve into the history of it, we hear equal parts resilience, but that's because Haitians, we have no choice but to be resilient.
Correct.
It's almost a pathological resilience, because you have no choice but to move forward and continue. But what's happening in Haiti is equal parts terror, but also heroism.
Yes.
Because
every day.
And we're talking about the terror, and you're hearing that, and we're living in terror. Our team is living in terror. Our staff that's going to work, our patients are in it. But at the same time, they're pushing forward. They're acting, because I've had team members, and I was like, be careful. And they're like, if our patient's going to show up, we're going to show up, because they're not going to be there for a reason. And I want to talk, you know, in that it is what's happening is an undeclared war or a phantom war. But you have warriors out there. At the same time, we have to address that we need to deal with this phantom war, and we need assistance for that. But let's also look at those warriors that are fighting for healthcare, that are saving lives, the women that are still coming for care, those obstetricians, of nurses. So I am overwhelmed by our team, because there's a spirit of resiliency in the face of this unimaginable terror that we're facing.
Yes, and I'd like to delve in a little bit to what that terror is. And for those who are just joining us, hi, I'm Dr. Cindy. You can read all about me on the page, but I'm joined today, this is World Health Day, and I'm joined by Mark Julmis, Executive Director, thank you for the correction, of Zanmi Lasante, which is Partners in Health partner in Haiti. And we're really talking today about the unique challenges currently being faced. You've heard our Mark just allude to the sort of silent war, proxy war that's going on, and how they're rising to the occasion to fight that. I think before we jump into what that is, it's highlighting exactly what also makes Partner in Health and Zanmi Lasante different in how they're dispensing care. And I love talking about the fact that you guys are very much coming in and on a social justice, social medicine landscape, really applying those principles that brought all of us to healthcare and humanitarian work. And especially the principle of training locals so that they can actually continue to deliver the care. So it's not simply, oh, we're bringing some people in for a couple weeks, they're going to do a mission and leave. And so what does the day-to-day look like for those warriors in Zanmi Lasante, even before this current crisis that we're facing? What is that workforce? Who are these warriors?
Oh gosh. I tell you, I feel, and I don't know, I get emotional when I think about our team, is we have the wide spectrum. You have community health workers that are living in their community, that are going to day to day. And let's be clear, even though they're living in their community, they are still facing having to go through gang territories to get to work. So they are local that's outside, that are living there, and that are daily going to find the women, find the children, find those HIV patients, find those TB patients, to make sure that they're getting their medicine, the social support, and all that they need. We have nurses, and I don't want to forget just about our technicians, because they're helping us, our biomed techs, those that are keeping our generators running, even in the midst of, I don't know if you guys remember starting in September, when we had this fuel crisis. Yes. Our technicians were on 24/7. Our team was on 20, trying to find any bit of gas on the road. Even with, I'm on the phone with them, they're like, yeah, they're shooting, I can't talk right now. And I'm like, oh Jesus, please be safe, please be safe. But they're like, we have to get the fuel for our patients. Yes. That's the technique. And at the same time, on World Health Day, I think we'd sometimes focus on nurses. And I'm a nurse, don't get me wrong, I love being a nurse, nurses and doctors, and we are there. But it is a village, it is a team that they risking their lives to get there. Biomed facilities, our nurses aides, our physicians and our nurses, and you know, the whole team, even our administration team, saying like, if they're going to show up, we're going to be there to support them.
Exactly.
Our clinical team, if the patient's going to show up, we're going to be there. Because if you imagine, even though we've changed schedules and so forth, our team still has to go through multiple gang outlets. And if you ask, we started something in one of our sites. They started sort of like a check-in. And if you dig too deep or ask a little, you'll start seeing tears pour down, but they're still there. It's that worry mentality. We're going to be there, but we can't forget that there's still a crisis that's hitting.
Yes.
And I am in equal parts awe and in equal parts terror, I have to say that, of our team that's going there into Artibonite, into Central Plateau, even in the Port-au-Prince area, to traverse these areas to make sure that we have the medications, that we're able to get things out of the customs. And I could go on and on. I'll slow there because going into, I want people to realize that it's not just throw your hands up and resign yourselves and say, oh my God, we can't do this. Haiti's in such a mess. We're saying, oh my God, it's such a mess. Let's run into the fire.
Let's run into the fire. Let's find this solution, right? We have to douse the fire. And a big part of dousing the fire is awareness and honest awareness. And so to speak to the crisis, really what we're talking about is we now have local groups fighting against each other, or what we in the US, etc., will term gang warfare, which is you have a turf war, right? You have turf wars at play, and now it's really blown up, if we put it in sort of simplified terms, but it's very much violent, which means for the person on the ground, the everyday Haitian who needs to conduct their life, go to health facilities, go get food, people who need to deliver services, this is now, they're being caught in the crossfire.
Right. And not to go to, because I think we won't be able to delve into this. I think there's even more so than turf war. There's a underlying phantom political war that we don't know who we're.
Yes.
And I think that's the part of it. If it was simple gang, there's so much more. And I know we're not going to be able to delve in. And I wish we can have time. And that would be sometimes that we dedicate to delving into the real issues behind what we're facing. Because yeah, it is gangs that we're dealing with, but it's even more so. There's that we just don't know why or who.
There are shadow influences at play. Major shadow influences with likely really global impact and footprints. Indeed. And so give us an example. You know, I had heard one example of the difficulty of bringing patients to, because Zanmi Lasante, it's clinics, you've got hospital. I mean, it's a true health network. And yet now you have limitations and restrictions in how those patients and community members who typically engage the services are able to access. And also you're now finding some difficulty in even delivering services because of what can happen, which is roadblocks, medications being stolen, other supplies, difficulty getting things off the port. How are you guys traversing that? And what can we, the listening audience, do to maybe help or raise awareness?
And I'll start from the backwards. I think it's a part of raising awareness and keep using our voices together to highlight it. Use like advocating at whatever political circles that we have. And I think this is where we have to continue highlighting the situations that are happening. But what we're doing is that for our patients, you have to realize there's a lot of medical centers and a lot of health centers and hospitals that are closing in Port-au-Prince. And they are coming to our facilities. So what we had before, where we had, and we were already I don't even want to say overburdened, but overwhelmed with providing services. And you can imagine even more so, especially if you're thinking about some of our pregnant women are starting to come up, and people that need these life-saving surgeries are going to our facilities and staying for days and months on end because they don't know if they could come back on the road. So they're living outside. And if you go to one of our facilities, Mirbalais or St. Mark or some of the other facilities, you'll see people camping out and staying there because they don't know if they could go back and forth. We're lucky that we had years ago built this mother's waiting house, Kai Mamito, and this is part of addressing those health disparities, right? That mother's waiting house, so women not because that they have higher risk pregnancies, but we do need to follow them a little closer.
Right.
We don't want to take the risk. So they're coming in and staying, we're holding them a lot longer in there. And so what you're seeing is the system, the ZL system, Zanmi Lasante system, having to expand to provide care, because we don't say no.
Yes.
We don't send people away.
Love it.
We'll do whatever it takes. And so even with this latest cholera crisis, you know, immediately as soon as cholera hit, the team was like, okay, what do we need to get? What do we, who do we need to touch base? What materials do we need to put? Where are we going to move? I mean, where are we going to move patients for, so that we can create the areas to provide care for those coming to us? Because we don't say no. Because if you make it to us, we're going to be there to provide care. And if you're looking into Artibonite right now, it's an even more hot zone, where we have our clinics in the Artibonite that locally, they have to traverse multiple gang areas, and they're still trying to get there. And so they themselves are saying, we need to get there. We're like, we've had to reduce some services and keep emergency services. However, they themselves, let's go back, are saying like, okay, I think we can move back and restart some services. And we're like, okay, let's wait and let's see. I can't go into the details because there are security things around, and we want to protect our team as much, but we realize that the advocacy is not coming from the administration saying we need to open it. The advocacy is coming from the team site saying this is what we need, because for us, it's personal. It is. It's not, it becomes personal, and saying like, this is our mama, our babies, our papas, our so forth. And that's the part where I think the thing for Zanmi Lasante and Partners in Health, it's personal. It's not just about being a patient somewhere. So
I like that. I actually think that should be part of Partners in Health's global network. One of their sayings, which is, it's personal. We're partners in health. It's personal, because it really is. And the work that Partners in Health does, you know, I had an opportunity to visit Rwanda and work with them last year. And it's just incredible what the meaning of social medicine has evolved to in what you guys do, which is, it's not simply delivering healthcare. It's also going in to check on what's the home situation, the living situation, because you recognize that in order for a patient to be healthy, all aspects of their life have to be healthy. So they have to feel good about their kids' education, their kids' nutrition, having a roof over their heads, having a means of earning income. And so you guys do all of that. In the context of Zanmi Lasante, what does that look like in your cities that you're working in?
And I'm just so happy that you got to visit Rwanda, and that site is such an amazing, yeah, it is. And all over, we talk about the 5 S's: staff, stuff, space, systems, and social support. Because you can't forget that, because we can have the staff there, we can have the space, we can have the systems, the staff, stuff, space, system. But then when you're coming to the social support, if they can't get there, you know, and you're talking about economic means, and we might not necessarily do it, but then again, our name's Partners in Health. Who are we going to partner with? Who are we going to reach out to? Who are we going to work together to bring those systems together? Because we might not be able to do everything, but we can partner with people that are doing that, and make sure that we're liaising, and our patients that come to us have access to that. What it looks like is, and one of our team members, I remember her also in the team advocating, it makes my heart so proud for not just, especially, you know, maternal child health delivery, but what about those kids that have issues that still needs that support, right? That's that continuation. And I don't know if you had a chance to visit Rwanda, where they have that child center, where it is that growth and development, that continuation, which is something we want to put. Several of our other sites have that, and we want to add that into Haiti. So it's not just a matter of, you know, you're delivered, it's maternal child, but it's maternal child, and then what's going on then? How's that support going on then with those mothers that have to deal with that family? We're looking at, we have the POSER program, which is really looking at that full on social support, housing, food, you know, in economic support that needs to be, so that you can help people get onto their feet and then become better. We have scholarship programs where people are able to go to school, and many people have come back and worked for us, right? So you're building that up. So it's not just a helping hand. I think I heard it somewhere, like it's a hand up. It's a support.
And you're truly lifting the entire community when you do that, because you're changing generations now. It's not simply saying, okay, we just improve someone's health here, but you're lifting an entire generation, which means you're changing generational expectations for families, generational ability to earn, and thus lifting people out of what, to allude back to the global shadow actors, what a lot of those same actors did to intentionally impoverish or cripple Haiti's own economic advancement. And so it's so great to see an organization able to come in and say, hey, we're aware of the history, and therefore we know it's not simply, oh, we need to provide you medications or provide you medical services. It's lifting the entire community.
Exactly. And you're changing health outcomes.
Mm-hmm.
I mean, and this is something I always say, I remember is when years ago when I first started with Partners in Health with Zanmi Lasante, I remember Paul Farmer, Dr. Farmer said to me, you know, history doesn't start with you. In a very great way, just to remember, study, know what came before we make a change. And that's the key part. Knowing what happened before in Haiti, how they changed health outcomes, how they changed health policies, how they changed the lives of people today who are living today as a testimony and are working with the institution. Why can't we continue doing the same thing? And that's the thing, is we're going to, not the why, we are going to continue doing the same thing, because history did not, we had the outline, and we're going to continue out with that outline. We have those that have, it's really exciting to me, because I tell people there are three organizations, I mentioned the other two, that I wanted to work with when I left school, and Partners in Health was one of them. And it was a dream actually to be able to be part of it, because the mission was not for the moment. The mission was the long game, was what are we going to change, and how we're going to get there to change is not what Band-Aid we're going to put on the solution.
And indeed, right, over the 3+ decades, that's literally what's happened there with Zanmi Lasante. Now there are medical schools, there's a residency program. I mean, you have a whole university system being built up around this principle, the University of Global Health Equity. We have just so many prongs addressing everything, including even the impact of climate change on the environment and people's ability to get just what you were describing, that social aspect of life and health.
Yeah. I think that's the big part of it. I think it's looking without limitations, right? And that's the big part. And again, it goes back to saying, when you're looking at disparities, and I know that's what you do a lot, right? It's not looking at the obstacles in front of us, it's looking at how do we get over those challenges? Where do we, not the saying, okay, this is too hard. It's really saying, how do we change this? And I would tell you, years ago, I had a mentor, which I love, or a couple of mentors that came in my life. And one thing that has been the consistent thing that they always said is, it's not just looking at the problem, get to know the community, get to know the problem, and then work to advocate with them to figure out a solution for them. That's why I love Partner Health, because it's getting to know the community, living with the community, and advocating with the community to get a solution. And and that's the part that I feel when we're fighting for health disparities, is giving them a voice, or amplifying. I should not amplifying their voices, helping them to amplify
their voice. They know what they need. It's a matter of people showing up and listening and saying, okay, how do I partner with you to make this amplified and get the change you've been seeking?
Yes. Because somebody said, what did they say? It was those that's closest to the problem have the solutions, most likely have solutions. And if we want to get there, like when you're saying, and I love that, and I was just really excited to meet you and learn more about the work that you're doing, because one of the things that we are amplifying is maternal health, and really wanted to talk to, because even in countries like Haiti, where we have a lot of health disparities, we also have to acknowledge that our disparities within genders, right? We still have to that. And one thing that we are saying is, let's work together and hear them, because even programs that we developed came out of what they said is what what the mother saying, this is what we need, and we listened. We walked alongside of them, and we and I keep saying, it sounds funny, but we partnered with them.
Because it's the right verb. It is the right verb.
And
it's what they needed, and it's what was given. And it's so as we speak about World Health Day and highlighting women and what women do, it's always amazing, especially when you talk to a mother, how she can really identify all the issues addressing and affecting her family, right? And so I'm always incredibly amazed when I talk with my patients and they can bring the whole picture in, and they'll say, well, okay, yeah, I didn't get the medication, but let me explain why I didn't get the medicine. I had to be at this appointment, or I had to take this child to do this thing, or I had to make sure that we purchase this blah, blah, blah. And so you start realizing, you know what, there's a whole network that we have to address before I start guilting my patient for not getting the medication, before I start going into the chart and writing that the patient is non-compliant or non-adherent. And so I hope that's one of the big takeaways we can send out today on World Health Day, which is to give your patients enough grace, particularly your patients who are coming in challenged for resources due to political involvement, social conditioning. Many of us ourselves as healthcare professionals are socially conditioned to judge those who we deem as being less than us. And as a result, we just assign them labels instead of looking for ways to help them. And, it's especially so when they see certain appearances or they hear certain accents, etc. And so in so much as we're talking today about Zanmi Lasante, I want those of you who are here listening, who maybe you have family from Haiti, you have family from the Caribbean, you've read with interest Haiti's history and sought and got inspiration from their resilience and the fact that they fought, and despite being crippled with some of the worst economic historical contracts a country could be ripped with for centuries, they still rise, they still strive, they still show up with hope. And we're hearing now about these workers and warriors who equally bring that hope to their day-to-day work. I hope you hear this and go ask yourself today, what can I do? And, yes, certainly you can pick up and say, I'm going to go there and I'm going to work. But you can also go to pih.org to learn more about Zanmi Lasante. You can learn about donating. Now, I did mention there are 12 plus locations that Partners in Health supports, but you can actually specify who you want to donate to when you go to donate. So if this conversation has drawn you in and you're now motivated to go make a donation, and it can be a small donation, there are no limits really on how much you can donate. It could be a big donation. We would love that too. Please go to pih.org, select the donate button, and you can actually also be more specific and select where you want your funds going to. As you can hear, your funds will actually help not just the healthcare work there, but the social impact work, the support work, the helping families keep the lights on, get clean, safe drinking water. There is a lot that you can do. Thank you so much for Zanmi Lasante highlighting here that you can also visit ZanmiLasante.org. I keep saying Lasante, ZanmiLasante.org as well. But I encourage you today on World Health Day, for those who are also celebrating Good Friday, it's a moment of reflection. For those also going through Passover, those celebrating Ramadan, these are all times where you're reflecting on your own personal journeys, your family's own journeys, and the historical reasons that brought you to your place in life. But I want you to also ask yourself, what would it be like if me or a member of my family were pregnant right now and we had to start making plans to go just live at a facility because we're really scared about whether or not we can get there when we're actually in labor, because the roads aren't safe, because of the issues with transportation right now, because of a war that's being funneled, fueled, funded by people you can't see day to day. Just imagine what that's like. And so we encourage you and entreat you to come in and learn more and help in any way that you can. But that's enough from me. Mark, what would you like to say to those listening right now on World Health Day, and what you'd like to see? I mean, you're there in Haiti, but you're also working on what is interestingly a very global issue.
Yeah. If you could permit me, can I just share one small story?
Please do. Go ahead.
So the level of of interest or the level that we take of advocacy. We have this program that we developed, and I think another time we can share. It's called Journey to Nine, where we follow the mother from pregnancy all the way to delivery, and then 1 year after, because we learned 75% of babies that die within the first, under 5 years old, die within the first year of life when we started this program. And we follow them to 1 year of life. And both of them initially, when you're talking about, and I like what you say, is listen to your patients, don't guilt them. Because when we first brought the concept, they were like, oh, for the maternal part, there's 9 maternal visits. And they're like, they're not going to come. They won't come. You know, we have like, was it 97% adherence rate to that maternal visit? And then there's 6 pediatric visits after. And then there's home visits that we do during maternal period and a pediatric period. Yes. So community health workers. So now it's a full team that's engaged in your life. And at one point we had a mother that lost a follow-up, that didn't show up for 2 visits. And our nurse accompaniers, which is what we deliberately called and called and called, could not find her. She herself, the nurse accompaniers, 8 months pregnant, decided to hop on a motorcycle and go to her community with her community health worker and recovered her, because the thing is, it's like something's going wrong. Something's wrong here. Instead of just assuming that they did not want to follow through, did not want to something happening, let's make sure that we're going to do everything we can to follow them. And that's what I want to take out is that spirit. Again, is going back to that. It's personal. It's not a patient. Something's going wrong. And what you said is, don't assume, like, get to know that patient, get to know the situation, get to know what's happening, and then figure out with them a solution for that if we can. Because what are those obstacles to healthcare? There might not be one of the ones that we haven't seen in the SDGs. It could have been. Let's figure out. And I think that's what we are about. Is when we talk about staff, space, and systems, we're and social support, we're about saying, what are those obstacles to healthcare that we need to work together and partner with to remove, and then so that we can continue to provide the care and give them access to the care that they need, not to put all the other blocks and dismiss it. And I think that's the part, is us wanting to really make sure that we are those partners in advocacy for them. We are the ones helping push things forward and supporting them.
And the support that you're doing is so transformative that it's so much of it can be applied even here in the United States. I think for many people listening, it seems, oh, it's far away. Oh, it's because they have other issues. But we actually have those very issues here in the United States. I did my residency in Baltimore, Maryland, and I very distinctly remember when there was a massive shift in me, where I had this patient who I knew she would come and be there even early. She so never missed her appointments. And so, like your story that you shared, she missed a couple, and I was like, I'm just going to dial her. I did hear from a nurse, a lot of patients here, they change address a lot. She's probably just moved, and now she's not able to come. I was like, but it's just odd that, she just fell off like that.
Yeah.
And so I called her up, and it was a story where I could hear a need. I reached out to the social worker for our department, and she was able to do so much to help her reestablish care, because she had lost access. Basically, she'd lost her home and she lost the ability to move around. And so, again, don't assume. And with that said, I think if there's anyone in the audience who has a question, we have like 5 minutes left. We'd love to answer a question or two for you. Just write it there, or you can enter it in our question section here, and we'll gladly address that. Where do you want to see Zanmi Lasante in the next year, Mark?
Honestly, the word that comes to my head is safe. The first thing I want to know, that my team members are safe.
That's got to be hard as a leader, as a team director, executive director, waking up in the morning and planning the day, but also checking in to know what's happening next. How do you manage that, as for those who are in leadership positions here, as an executive director? How do you go about that, and how do you protect even your own mental health and safety while you're doing that?
I think there's really no prescription, and I think right now we're all going on a day-to-day to see what is asking our team members, like, what do you see? What can we do? How can we change? What do we, and again, I can't go into the details because of security.
Right.
We want to keep things as certain things as safe as possible and confidential as possible.
Mm-hmm.
However, we currently have people that are, you know, are trauma. Everyone's traumatized. We are leaning very heavily on mental health. We have decided late last year to include into or mid last year, sorry, include into our team a wellness officer, so that it's focusing on our team members. And so that we do have mental health, very strong mental health for our patients, but we had to focus and say, let's get that for our team members so they have somewhere to turn to. And so I don't know if it's enough. I think when ideas come, for us, it comes too late, but we're moving forward with what we know and are open to suggestions from any team members to say, how can we help this? But honestly, this is a situation out of our control. That we are taking every measure that we can, but there is a lot that needs to get done on the national level.
And we need a lot of people to advocate. We need a lot of people to get out there and start asking, hey, what are you doing? I think currently in the US, when we do hear mention of Haiti, it tends to be tied to, you know, rhetoric around the southern border, and people aren't really asking, well, why do we now have what seems to be a surge across the southern border with Haitians coming through? And I don't think a lot of people are asking what must be happening in Haiti.
Right.
That's leading people to flee their home, their family. This is not 20, 30 years ago. Something's changed. And people haven't really been asking that, or asking that of their representation, which we need to do. We need to do more of that.
And I want to share something too there's a lot of Haitians that don't want to leave. A lot of our team members, when we're talking to them, they're like, we actually don't want to leave.
Yes.
People take their families away so that they can focus and they're not worried about, you know, correct, are they safe here? And so there's a lot of people hoping and holding on to that string that something's going to happen. Correct. And I said, I don't want to leave. So it's not, and I think if we can work with that and people realize that Haitians, a lot of people don't want to leave their home country.
Haitians love being Haitian. They love Haiti.
Yes.
That should not surprise anyone.
Right. And I think people start saying like, oh, people look at that people are fighting to the last what they can fight for. And it's what can we do? And I'm very proud of our policy and advocacy team, because at the same time as that they're fighting to be there present, yes, we are continuing to fight on another front to get amplification, volume to this issue so that we can accompany them to continue doing this work, because they are fighting to be present on a day-to-day basis. And yeah,
I mean, it's not easy, especially, you know, it's not easy to go to work knowing your own family may be at risk while you're at work. Yeah. It can't possibly be easy, yet they managed to do it, and do it so well, to bring so much hope, to be able to cheer on that patient who's delivering a baby, cheer on that growing child who's recovering from illness, or, you know, recovering from surgery. And that's the thing, you guys are doing everything. Mark, you yourself, you were very much involved in the first in-country separation of conjoined twins in Haiti. What was that like?
That was amazing. That time was just, again, it was a learning experience, because this is where you have skeptics. And I would say, I thought I was one of those, yes, let's do it, until it came to that particular separation. Yeah. And I'm like, oh no. And I remember Paul Farmer saying, don't tell me. He was like, Mark, tell me what we need and don't tell me what we can't do. And at that point, it was like really trying to say, let's move forward and like get over those obstacles. And it was amazing, because to see what ended up happening, having because it was actually triplets. First of all, people don't realize the amazing delivery that we had. Yes. So it was 3 babies and 2 conjoined, and this mother has not had a success. You know, she's wanted to carry these babies successfully and delivered at 36 weeks and I believe 6 days, if I'm correct. And that alone, delivery, we had 4 teams in the operating room, 1 for each baby and 1 for the mama. Everyone had it was an organ. It was just like this orchestra.
Yes.
everyone planned out, and we planned different solutions. If the babies were, if one was, you know, in cardiac or had respiratory distress, what do we do? So the whole team, and this was delivered by all Haitians.
Yes, all Haitians, which
all Haitians for the delivery.
The level of care and service that you guys have built out. I want people to hear that. We're talking about an organization that came into Haiti and over the course of these decades has built what is a full functioning, high level healthcare system, and then expanding it out to an educational system, residency, medical school, residency. So someone who grew up in the community can now go to medical school there, train there, and therefore these are the people who are also more likely to stay on and continue the work, and they have. And so that's why you're hearing this passion. That's why you're hearing this dedication. But I want you to understand just how amazing the work is. And this is high level work at every level. I mean, social work, we've heard about the technicians, we heard about those who went just above and beyond to find fuel to ensure that things were working. These are people who are consummate professionals and truly dedicated to the job and to improving the community. Well, Mark, I don't want to keep you too much longer because I know you have a lot more to go get done today. I want to thank you so much for joining me. I want to thank you and Partners in Health for indulging me and doing this conversation on World Health Day. It really means so much to me. It means a lot to my family. It means a lot to my dear mom. Today is the 6-month anniversary of her passing, and this really, you know, she herself would whole lives just asking, why aren't we talking more about Haiti and what's happening? And now I think we really need more people to put a spotlight and a focus on what's happening. But also, like you said, as Paul said, don't just tell us what we need. No, sorry, tell me what you need. Don't tell us what we can't do. And right now, you just told us what we need. And so what you guys need. So we need to go to PIH.org. We need to go to PIH.org, learn more about the work. If you're interested in working with PIH, there are links there where you can sign up. If you can and are willing to donate, or you want to do a fundraiser to support them, please learn more at PIH.org, or you can also go to ZanmiLasante.org. Thank you, everybody. And Mark, I'll let you say goodbye and then I'll end the live.
Oh, wow, Dr. Duke, it was such a pleasure just to talk to you, and I feel like I want to drink in some more of your knowledge. So whatever.
Same here.
Yeah,
Indeed.
And thank you for just helping spotlight. I think World Health Day is such an amazing time to share overall the advocacy both in the U.S. and in countries such as Haiti.
Yes.
The need to continue to push forth for health equity. Not necessarily equality, but equity that's happening, and seeing where do we need to amplify and where do we need to support, and being in both, having been in both systems, there's, like you said earlier, there's so many similarities, so many similarities, and we have PIH US too now. I'm just gonna put it out there. Indeed. But there's so many, there's so many similarities. But I am going to put down that I am fortunate to work for an organization that believes in the right to have healthcare, access to healthcare, and also fights for the right to access to healthcare.
Because healthcare is a human right. So true. So true. Well, thank you so much for joining me. Guys, speaking of the US, next week is Black Maternal Health Week. A lot of what we just talked about applies right here in the United States. And we'll try to highlight some of it during Black Maternal Health Week. But today, World Health Day, go to PIH.org, learn about the organization, donate if you can, set a bookmark so that the next time you are looking to donate, you can make a donation. Like I said, you can actually specify, and so you can select to donate directly to Zanmi Lasante. Thank you so much, everybody, and enjoy the rest of your Friday and the weekend.
Bye. Thank you.
Bye.